As many of you know, Advanced Instruments is a global leader in osmolality testing. Measured osmolality using the freezing point depression method is an important screening tool for the differential diagnosis of body fluid disorders. Our osmometers are trusted to give rapid and accurate measurements of a body fluid's osmolality. Even a slight shift in the osmolality of a patient's sample can be diagnostically significant, making a robust osmometer quality control program critically important. This will be our focus for our discussion today. High serum osmolality can result from hypernatremia, dehydration, hyperglycemia, mannitol therapy, azotemia, ingestion of ethanol, methanol, and ethylene glycol. Osmolality has a role in toxicology as well as coma evaluation. Elevated serum osmolality with normal sodium suggests possible hyperglycemia, uremia, or alcoholism, whereas low serum osmolality may be secondary to overhydration, hyponatremia, and syndrome of inappropriate antidiuretic hormone secretion. Both osmolality controls and our Clinitrol 290 reference solution should be run daily prior to testing patient specimens. While any brand of osmolality control can be used, we recommend using our Protinol, protein-based controls, and Renol, urine-based osmolality controls to verify instrument performance for a number of important reasons. First, controls should challenge medical decision points. Freezing point osmometers make measurements over an extremely broad range, so testing controls at medical decision points ensures the accuracy in the clinically relevant range. Second, controls should have tight ranges to quickly spot shifts in instrument performance. Controls with a reliably tight acceptance range enable the detection of small shifts in instrument performance. Even a slight shift in patient osmolality values can be diagnostically significant, so it's important that control ranges should have an accordingly tight acceptance range. Third, controls should mimic patient samples. To provide the best control for osmolality testing, a solution should be in a matrix that closely resembles the specimen being tested. The more similar a control is to a patient sample, the greater confidence an operator has in the instrument performance with that sample, therefore computing the correct result for a patient to be treated correctly. Fourth, controls should support compliance with regulatory guidelines. The International Standard for Medical Laboratories specifies that the laboratory should choose concentrations of control materials wherever possible, especially at or near clinical decision values, which ensure the validity of decisions being made. In the United States, CLIA requires daily use of at least 2 control concentrations, where CAP further requires that these 2 concentrations be at clinically relevant decision levels. And lastly, controls should have a manufacturer-provided peer group for results comparison. Peer group programs serve as an external quality control assessment where laboratories can compare their control solution results with those from other laboratories to identify trends. Following the regulations and guidelines previously outlined, an ideal serum control should mimic patient specimens and provide values at medically relevant decision points. For controls used with osmometers, the requirement to provide values at medically relevant decision points is unfortunately not universally met. In healthy patients, a normal serum osmolality value for patients in seniors is between 285 to 295 milliosmoles. The chart shows the product insert specified mean values in ranges of serum controls from 3 manufacturers averaged across recent available lots. The normal serum range is shown by the green band on the chart. In children, the normal range is 275 to 295 milliosmoles. Possible critical serum values are less than 265 milliosmoles or greater than 320 milliosmoles, shown on the chart with the red dotted lines. Advanced Instruments Protinol is the only serum control examined that has control levels at clinically relevant low, normal, and high values. The 240 milliosmol level is near the low critical value, the 280 is within normal range, and the 320 level is near the high critical value. Bio-Rad has only one level within the clinically relevant range of patient values. Level 1 is near the critically high value with no levels covering the low or normal range. Randox does not offer levels near low, normal, or high values for serum osmolality. All three levels far exceed the critical high value of 320 milliosmoles. To ensure that your lab is confirming the instrument performance at clinically relevant levels, we recommend using the Protinol protein-based osmolality controls for your use with the Advanced Instruments osmometer to ensure accuracy. Unlike serum osmolality, urine osmolality values range widely depending on many variables, such as hydration status. For a healthy adult, urine osmolality values can range from 50 and 1200 milliosmoles depending on the subject's fluid intake. Not all control solutions offer reliably tight ranges, as a small difference in a patient's urine osmolality value can bring a diagnostically significant. It is important that controls have a tight acceptability range so operators can detect a small shift in a patient performance. At plus or minus 10 milliosmoles, Renol offers the tightest range of commonly available urine control solutions. Renol also provides the lowest value at 300 milliosmoles to verify performance across a wider range. For these reasons, we recommend using Renol urine osmolality controls while using your Advanced Instruments osmometer. In summary, as you can see on this chart here, Protinol and Renol meet the criteria required for effective osmolality controls. Both products challenge medical decision points, have tight ranges, and mimic patient specimens in adherence to regulatory guidelines. There is also a peer group that you can use to compare your results to those of other labs.